Getting better at drawing means you do have to study sometimes. So that's why I've put together this comprehensive video. I show you how all of the muscles of the face work and what they're used for. So whether you're here voluntarily or your teacher made you watch this, I hope you enjoy it. We're going to start with a skull. Now, if you don't have one, you can download a free skull template on my website. I have a bunch of other guides there too if you're interested. So just throw a piece of paper on top of that and trace it. So this is where we're going to start. There's a little bump here at the top of the lower jawbone. It's called the coronoid process. And from that point, you have this clam-shaped muscle on the side of the head. That's the temporalis muscle. Its primary function is to help you chew. So that temporalis muscle attaches to the coronoid process, but you can see it goes underneath the cheekbone, the zygomatic bone. Also attaching from the cheekbone to the lower jawbone, the mandible, is another chewing muscle. This is a huge muscle called the buccinator. And I'm just drawing the different strands here. But yeah, that helps you chew as well. Let's shift our focus now to the eyes. Now there's a large circular muscle around each eye, and it's called the orbicularis oculi. And you can think about the word orbit, meaning to go around. So orbicularis, and then oculi means eye. So this thing goes around the eye. And you can imagine the eyeball kind of being in the middle of that donut. And the purpose of the orbicularis oculi, well, there are a few, but basically it's to close the eyes tightly or to close them gently. But also it compresses the lacrimal sac, your tear duct, and helps you cry when you need to. Okay, now I'm going to draw the lips, just so that I can show you the exact placement of the other circular muscle. It goes all the way around the mouth. And this one is also an orbicularis muscle, but it's called the orbicularis oris. Oris means mouth. Think oral, like your oral cavity or oral care. So that one goes all the way around the mouth. And what that muscle does, it helps you close your mouth. But it also helps you protrude your lips or compress your lips. Let's move to the forehead now. You have these two clam-shaped muscles. These are called the frontalis or the occipitofrontalis, and they are responsible for elevating your eyebrows and also for wrinkling your forehead, if you can do that. If you like this video and you're new to drawing, please do consider my book, The New Artist's Guide to Drawing. It has everything from the face, the body, animals, landscapes, and more. Next you have this upside down triangle that occupies the area between your eyebrows. By the way, that's called the glabella, the area between your eyebrows. And this muscle is called the procerus. What it does is it brings down the inside of your eyebrows, almost in that frowning motion, you could say. And helps to wrinkle your nose too. And beside the procerus, you have two little muscles that are responsible for helping you frown. These are called the corrugator supercilii. And yeah, try not to use those ones too much. This skinny muscle running from your nose to the top of your mouth has a really long name. It's called the levator labii superioris aliquae nasi. So what does that mean? Levator means lifts. Labii superioris means the top lip. Aliquae means the wings. Nasi is nose, so the wings of the nose. And right beside that you have the larger levator labii superioris. And you can think about that as a snarling muscle. So it's responsible for elevating your upper lip, and you can expose some of your teeth that way. Kind of the Billy Idol of muscles. There's another little one here, and that's the levator anguli oris, and that's responsible for lifting the corners of your mouth. Next we have the zygomaticus minor, and that's responsible for helping you control the shape of your lips, and in particular this one elevates your lip. And there's another one here that attaches also to the zygomatic bone, and that's the zygomaticus major. And this is, you could consider to be a laughing muscle. This one helps you laugh by elevating the corners of your mouth. If you have at any point used that zygomaticus major muscle, that smiling muscle, please do consider dropping me a like, a comment, a share. Anything to boost the algorithm will be greatly appreciated. This little sideways one has a pretty cool name. It's the risorius, and that one helps you move your mouth sideways. Okay, let's go to the chin now. We have these two little ones right at the end of the chin. This one's called the mentalis. It helps you protrude your lower lip. Also wiggle your chin if you think that's something that you might want to do. Right beside the mentalis, you have the depressor labii inferioris muscle. This one helps you control your lower lip, kind of moving it sideways, I guess. And just on top of that, you have the depressor anguli oris. Remember, where you saw the levitator anguli oris, this is the depressor anguli oris. That has the opposite effect. So that one just helps you lower the angle of your mouth, which obviously is important in speech and other functions with your lips. You have a few more little muscles here on the nose, but the tip of your nose is not made out of muscle. It's a cartilage. So I'll just pop that in there. You do have a few more muscles in your face, particularly around the ear, but this is pretty much what you would need to know if you're interested in furthering your anatomy knowledge of the face. I just want to give a big shout out to my Patreon supporters, or anyone who has helped the channel financially. And if you're not in a position to help financially, please do help out with a like or sharing the video. Until next time, happy drawing.